Perfect. Okay. 10 people that couldn't make it because of election types of things and work and stuff like that. Ooh, there's more in the waiting room. Awesome. Okay, cool. Good deal. Welcome, guys. Again, thank you for being here. I am Angela. I am a distributor with Young Living Essential Oils. And there we go. Let me see what just happened. I don't know what just happened. Sorry, that distracted me. I hope they're still recording. I got a weird message on my screen. Okay. Anyway, I'm going to start screen sharing here in just a brief moment as well. But I am so excited to have you guys here. I've been with Young Living for almost 10 years, coming up at the beginning of 2025. It'll be 10 years. And earlier this year, Young Living created this partnership with Clearwater, which is the health share. So I'm sharing my screen now, but I'm super excited for this to share with you about the benefits. When I first heard about it in January, I was like, that's too good to be true. I'm not going to do it. I don't even know what that means. I didn't know what a clear or a health share was because it's not traditional insurance. It's different. So my goal is to explain that to you tonight, share that with you, and give you some information and introductions. I know a lot of you have filled out the questionnaire so that I could give you a comparison to what you currently have. And we can always dive deeper into personal situations, personal questions that you may not be comfortable asking here in the group. So it's totally fine if there is something like that, or you have a special need that you want to address. So Clearwater. Clearwater is the health share company that partnered with Young Living to bring better pricing for healthcare to individuals and families. So they have been around for 6 years. There are over 50,000 members that are paying monthly premiums. That number I feel like is important because when there is a medical expense, we want there to be a lot of people that can help to share the cost, which means that our monthly premiums can then stay low in return. So if there's something major that's medical, then we're sharing that cost and again, helping to keep those monthly premiums low. So the goal of a health share is to make it so that things are more affordable. But one of the differences is that a health share is a nonprofit. And now insurance companies, you may or may not know this, insurance companies are for-profit businesses, and they are one of the most profitable industries in all of America. It's like the top 3. It's a multi-billion or maybe even $1 trillion industry as far as profits, making the people at the top of those companies very wealthy. And it's sometimes really hard to get things approved. You may have dealt with issues, getting claims rejected and stuff like that. Within the health share, the guidelines are a lot more clear and you can see what's going to be covered. And we're actually going to show that to you tonight with some direction and clarity so that there's not any question or issues for that. So and this talks a little bit more about what is a health share and sharing that information or sharing the costs of health premiums and the ability, again, to help keep costs low. And you choose what your annual max is. Again, if you've already filled out that questionnaire in the link that I shared with you, the options, $1,000, $2,500 or $5,000 a year. Obviously, the larger your max out of pocket, the lower your monthly premium is. And so based off of goals and the questions that you answered for me, I share for what might be best to meet your goals and what that is, but also take into consideration what you currently might have and what your budget is. This, again, a little bit of a comparison. What is a health share versus what is traditional insurance? Like I said, health share is not for profit. And with this health share, one thing that's really nice is that you can choose any doctor. So where you maybe with traditional insurance used to have to get approval, find out if they are a doctor that's allowed or that will see you or whatever it is, none of that is the case anymore. Claims, again, are rarely denied. The goal within a health share is to keep us as members happy so that we stay, keep paying our monthly premiums, again, to help keep the cost for everybody down, or as low as possible when there is a major medical incident for people. And again, like something about a nonprofit, you may or may not be familiar, is that a nonprofit has limits on how much money they can have or can profit and keep left over at the end of the year in order to keep that status. So it really is focused more on the people versus insurance companies. You're more of a number, that type of thing. I used to work in the insurance, or not the insurance, in the healthcare industry. I was a clinical technician, and I worked in the operating room, and then I also worked with a lot of podiatrists or primary care physicians for 12 years before leaving in 2020. I left in August of 2020. And I remember sometimes seeing the cost and the greed within that industry and just being amazed and thinking, man, this is like not the place for me, because it just felt so icky, for lack of a better description. So that's something that I always think of. And I'm glad for my own family that we have definitely made the shift, and we're saving hundreds of dollars a month ourselves. So within the health share, there are three main options. So there is, and I'm actually going to start from the right and move to the left. There's clear share, which is medical coverage. So this is if you need a hip replacement, or you fall and break a leg, or you are in an accident and there's significant expense. In that case, you go to any doctor. Again, there is no limit on the doctor you go to. So if it's an emergency, you go to the closest emergency room, but if it's not, then you can go to any doctor and have the same coverage and things taken care of. Essentially, you get 100% coverage, or 100% of your cost shared after the deductible or the max that you set. It's the same number, it's different terminology within health share. So that's the medical piece. And when you have something like that happen, you actually get an invoice from the doctor, and then you submit it to Clearwater for a reimbursement or payment, or for it to go towards your annual max that you have set up. The next option is the important part of where Young Living, my company, comes in with the relationship and the connection, is that you can have holistic coverage. So sometimes insurance companies cover chiropractic, and that's typically at most 12 visits a year. With the holistic options, there's a couple of them, but with the full holistic option, which is what a lot of people have been choosing, or has been comparable to their healthcare currently and better than most of them, you get 24 visits to a chiropractor or an acupuncturist. That's pretty uncommon on most insurance policies. Acupuncture is usually not included. You get IV drip. I've never spoke to somebody who has IV drip, and it's once a month. So you could go 12 times a year to have an IV drip, and it's up to $100 covered. You get prescriptions. If it's a generic prescription, it's $0 cost to you. And then there's also like primary care physicians. Within that primary care physician visit, you can go see a naturopath, any licensed physician. So that's also something that's typically opening the doors for people compared to traditional insurance. When I had traditional insurance, they didn't ever cover me going to see a naturopath. I always paid out of pocket, 100% cash for that type of thing. Holistic option, if somebody has a pre-existing condition that makes them not eligible for the shareability of the medical side, you can still get holistic, because it's very clear. This is what we cover. This is how many visits. This is the individual's cost versus what will be shared or reimbursed by Clearwater. Within the holistic side, same as the medical, where you get an invoice printed out, you make the payment in full, and then you submit it to the Clearwater. It's very easy. It's on an app. I've done this multiple times for myself and my family, and then you get reimbursed. So let me give you an example of this. On the chiropractor that I went to, my chiropractic visit was $60. I added on a supplement that was, I don't know, 25-ish dollars. So my total visit was 75. And so I paid that to my chiropractor, submitted the receipt, and then my out-of-pocket cost is 35 per chiropractic visit. The rest was reimbursed to me in my checking account. So I went on September 21st. On October 6th or 7th, I got the message that it was all approved and going to be reimbursed, and it was in my checking account on October 11th. So I do electronic. You can get a physical check mailed to you, but obviously it's faster to do it electronic. Now, for chiropractic, you can do add-on services. This is a huge deal. So when you go for a chiropractic visit, the total cost of the invoice on there can be $210. You would pay $35 and get reimbursed up to $75. So you can get a chiropractic adjustment. You can add on massage. You can add on red light therapy. You can buy a supplement or a product that they have. My chiropractor sells electrolytes that Young Living doesn't have. And so that's what I purchased as my add-on when I was there. It's really whatever service your chiropractor offers that you want or need, you can add on at the same time as a chiropractic adjustment. The important piece is that you make sure it's on the same invoice, and that you're doing it at that same visit. And it's super easy, super fast. Again, my doctor, my chiropractor, sends it to me electronically. I take a screenshot with my phone and submit it. So it only takes me a couple of minutes to do that. Then the third option on the far left is holistic plus clear share. So you can get the medical coverage and you can get the holistic coverage if you are wanting that. So it's different options, whatever your needs are and your desires. Oh, and I forgot to mention with the holistic option, the part of the relationship with Young Living is that you can get essential oils and or supplements from Young Living. As an individual, you would get $50 reimbursement every month for anything you choose within those categories, oils or supplements. And for families, it's $75 a month that you get reimbursed. Again, same thing. I place our order like I always have for the last 10 years, take a screenshot of the invoice, upload it and submit it. And then a few days later, I get reimbursed, or a couple weeks. This is my family's example and comparison. I like to share this because it's what finally helped me to see that it was really worth it. Again, I spent 7 months. I didn't even, until from January to July, I wouldn't even sit down and like attend one of these classes to learn about it. But in July, I was in Salt Lake City for our convention. And I thought, okay, I'm just going to go check out this class and see what this is. And I thought, holy cow, this is crazy. The amount of money that my family can save per month. And when I was pregnant, both of those years, I ran out of chiropractic visits. So I shifted to paying cash only. So I didn't, 100% of the cost. I didn't like that it was capped at that and that I couldn't go to a chiropractor. I couldn't do IV drip, any of that stuff. So, I mean, obviously I could, but pay for it type of thing. So a couple of other things that I did like is the telemedicine. You can get 24/7, 365 days a year telemedicine for no charge. And if it's something that requires or needs a follow-up call, you meet with the same provider. So it's not meeting with somebody new and re-explaining the whole situation. That's something that I hear for sometimes like with urgent care facilities. It's just whoever happens to be working, or maybe with your doctor's office or that kind of thing. And there are some other telemedicines through insurances, but again, this is like you have the same person following you throughout whatever the issue is that you're dealing with. And if it's something that's a big deal and they feel like you need to go to the doctor in person or a hospital or an urgent care, obviously they will tell you. And then the telehealth for mental care is also free. So that's a nice coverage option as well. So you can see for my family, the monthly premium went from $1,560 to $955. So we're saving over $600 a month. And I was just sharing with somebody that couldn't be here tonight that what we're doing with that extra $600 right now, because this is still new to us, we've only been doing it for a couple months, is we're putting that extra money into a account. So I have all of this stuff, my monthly premium paid out of an account where then I get my reimbursements, and then I'm putting that extra money into that to build it up. And we chose a $2,500 deductible. So, and actually, we have a couple of health or medical things that we're going to be doing in 2025. And so I think I'm going to change it to 1,000, down to 1,000 in December, which would make it active in January, so that we don't have as much out of pocket for that. And our monthly premium only goes up, I think it's like $50 or $75. So it's not very much, and it feels worth it to us to do that. So I know there's a lot of information on these next screens, but I wanted to share this with you so you can look. You might grab a pen if you haven't seen this yet and you haven't already done the questionnaire and had me send you the information. But the way that it works is first you look at your category. This is for medical coverage only. Your category is based off of your age or the oldest person that is going to be on the policy with you. And so then you look in the columns to see what you want your annual max to be. Do you want it to be 5,000, 2,500, or 1,000? If there's anybody that needs me to zoom in on a specific area, because I know that it's kind of small, especially if you're on a phone, which I know some of you are, I can do that. But this one is if you aren't interested in the holistic coverages, you can absolutely do this and have it work on its own in place of health insurance. Cool. I don't want to spend too much time on it, but I did want to give people opportunity to unmute if there is anybody who wants me to zoom in on a specific category or share with you the numbers. The next one is if you want holistic only. So the holistic only, again here, so you'll see as you go down within that section, single, if you're married or cohabitating, family with kids, and what the monthly cost is. And so again, this is for anybody if you're 65 or older and you don't qualify for the medical side, if you have a pre-existing condition. Like if you're going through cancer treatment right now, that's a pre-existing condition. It would not make sense for you to switch from health insurance to this. But you can always have the holistic because a lot of times if we have like a major diagnosis or issue, it makes us open our eyes to be like, wait, maybe there's something different or better that I could be doing to support my body and my body's wellness. So you can do the holistic coverage option only if you want. Or some people, I have a couple of people, this isn't as many, but I have a couple of people who have good health insurance, like maybe they have military coverage or they're a W-2 employee and their company pays 50% of a $400 or a $500 monthly premium. In that case, it doesn't necessarily make sense, but this might make sense if they're like, they pay for medical things, but I can't go to an acupuncturist, I can't get massage, I can't get these other things that I want. That's when this one makes sense for a lot of people. Next is if you want to do the combination. So this is holistic savings with the medical. So as I mentioned, there are two options within the holistic side of things. So if you want some holistic coverage, but you don't want the cost of the whole full holistic coverage, this is a great option. So on this one, some of the difference things that you might have or that you would have are chiropractic visits. So the combination of chiropractic and acupuncture goes from 24 visits down to 12. And this is per person on the policy. I want to make sure that's clear. So if you have a family of 5, that would be, each person getting that number of appointments. The holistic savings option does not include annual breast exams. So with the full holistic option, you can do mammogram or thermography. Thermography is also something that's typically not covered by health insurance. So for some people, again, if you have a holistic outlook, then that might be a big deal for you. Personally, I was spending $300 to $500 to get thermography. And so that was something that was a big deal for me. Now it's $150 a year to be able to go and get that through this plan, where previously I was paying for that 100%. This one is the full holistic option. So as you can see, it's a little more in each of the categories because you're getting more visits, you're getting more coverage for each of those. Vision and dental is an add-on. Again, so depending on your preferences, when you filled out the questionnaire for me, I listed this based off of if you currently have it, wanted to keep your coverage, or add on something. And as you can see, it's based off of single, married, single with kids, married with kids. And this one, there isn't a specific pricing based off of ages. So a 20-year-old has the same price as a 50-year-old on this. And then it shows you a little bit of the coverage when it comes to vision or other dental types of items that you may have that are happening. This here goes into a little more detail of the holistic that I kind of already shared with you. Again, if you do the full holistic option, you've got the essential oils or supplements that are covered for either $50 or $75 per month. Your primary care visits, again, if you can see on the right side, how you can, this is totally open to osteopathic, naturopath, your functional care, really any licensed provider that you may want to see, you can go see. And then your final cost after you've been reimbursed is just $20 per visit. So it's similar to what you might be used to as a copay. Breast imaging, again, chiropractic, acupuncture, IV drips, and then your prescriptions are down there at the very bottom. Some people have asked me, what if they're taking a prescription that's a brand name? You might check to see if there's a generic that would work with you or for you and not have any, different side effects or issues. But for brand names, it's not like a set price. Again, probably the same as your insurance. It depends on what it is and what the cost is for that. So it would be case by case. My dog is about to bark, so we'll see how this goes. My husband just brought the dog to me, so I think he's putting our kids to bed. This explains the holistic savings and the differences. So again, you still get the supplements, the primary care, chiropractic for 12 visits a year. And those 12 visits can be chiropractic or acupuncture. It's totally up to you. You can go to the chiropractor one time, acupuncture 11, or acupuncture all 12 times. Whatever the mix is totally fine. It's just a total of 12 per year. Again, this shows the $50 for the individuals and $75 for couples. This has been another common question. So if somebody has an issue or a condition or something that's going on or something that they might be looking for coverage on, maybe treatment that you might need in the future, this is a list of all the things. So again, no network, you always choose your doctor, accidents, emergency room, hospital services, telemedicine, virtual mental health sessions we talked about. I want to talk about the care coordination. That's the next item on there. If you have a health issue, so there's a gentleman who, I can't remember if it was a knee replacement or a hip replacement that he needed. I think it was hip replacement. The cost for that hip replacement was going to be $80,000 at the hospital where his physician was wanting to do it. And so he contacted Care Coordination, which is a department that helps you to make sure that you're getting the best care and the best price. And what they discovered through their research is the same doctor also does surgery at a surgery center, which is, if you don't know and you're not familiar with medical, it's typically a lot better because it's a lot more cost effective. Your stay is typically shorter and your risk for infection is significantly lower. I used to work in the operating room from like hospital to hospital, office to office. So I traveled around and so I'm very familiar with this. It's significantly different when you look at the results in the surgery centers. So they found that this doctor does surgery, the same surgery in a surgery center, and the cost would be $40,000. So obviously the patient chose to go to the more cost-effective place. And by him using the care coordination department and allowing Clearwater to help save money for everybody, obviously, right? Because we all pay the monthly premium to pay towards his bill, whether it's $40,000 or $80,000. And so with that, the benefit of that is that his annual max was forgiven for that surgery. He had zero out-of-pocket cost because overall he saved all of us within the organization $40,000. So that is a huge benefit. Again, nothing from health insurance ever has anything like that. So I like to point that out. But again, as you can see, having babies, pregnancy, postpartum, home health care, pain management injections, hormone therapy injections, medical supplies, nutrition. I mean, all kinds of things are covered. Speech therapy, massage therapy, inpatient. I do want to talk also a little bit about massage therapy. So as I mentioned, massage therapy can be covered as an add-on service to a chiropractor. There's also another way that you can get massage covered for the year. If you have a health issue or a condition and a doctor writes you a prescription for it, there can be up to $3,000 a year approved for you to get massages. So that's something would be case by case if there's a medical condition separate because it's on the medical side, not the holistic side. The holistic side is when you're getting it as a more of a preventative health, to stay healthy, and it's an add-on at the chiropractic level, and that's more of the holistic plan. So I wanted to kind of explain that because I mean, technically you could probably get both if there's a need and you have both the holistic and the clear share or the medical coverage. Again, there's skilled nursing facilities, there's hospice, there's weight reduction, hyperbariatric therapy, all kinds of things. I haven't found somebody yet when doing a comparison that had a medical need that wasn't covered. So I like to explain and share this because, again, it's not health insurance, it's different, but it's just as good. And for myself personally, it's been better. It's allowing me to be more proactive about my health and take care of myself. So again, this kind of explains what I talked about in the beginning. Clearwater created a partnership with Young Living, and that's what allows you to get the pricing and the plans and the coverages that I was talking about. So I can walk you through it. I would guide you through that process, but you have a Young Living account that you set up. Some of you already have one. If you don't, we would set it up. You can make a purchase to get that account, or you set up a free account. Then we get you connected through Clearwater. Your monthly premium that was on the screens before is paid to Clearwater. Again, it's a partnership with Young Living. It's not like the payments going through Young Living at all or anything. So, does anybody have any questions for me? This last screen here, I think it's my last screen. Yeah. It kind of shows what the process is like signing up for the program. So let's say you want coverage to start on December 1st. You would sign up between now and November 30th. I don't recommend waiting till the end of the month because Clearwater gets busy. Obviously, lots of people want to have their coverage switched over. But you set your account set up. It would be active on December 1st, and you don't make your first payment until December 9th or 10th. Typically it's whatever is a business day. So it's a really nice way to be able to start getting your coverage and figuring things out. I can help you get the app set up for your reimbursements and all of that stuff. So, oh, I see that there were some questions here. Oh, great question, Terry. So no, if you're not looking for coverage for your spouse, then you would only look under the single section. And oh, cool. Vince, thanks for the question. Terry, let me go and pull up my notes real quick, and then I will make sure that I answered Vince's question as well. So yes, Terry, I have some comparison. I sent you a message on Facebook for your specifics, but I would recommend probably staying with your current health insurance because it is so cheap, and then it's a really good price. I shouldn't say cheap because it's obviously an investment. And then we could look at holistic options for add-ons and that with either holistic or the holistic savings. So Vince, to answer your questions, the claims process. So again, if it's if it's a medical claim, then you get an invoice from your doctor and you submit that to Clearwater, and you would pay your max out of pocket. And then anything above and beyond that, Clearwater would take care of. Now, one of the things that, let's say it's something really expensive, and it was an emergency situation. So it's not like you contacted them and asked them to help you get the best price. In an emergency, you're not going to do that, obviously. They would then act on your behalf to help get any discounts that they could, again, to help reduce the cost throughout the group or the organization. So they walk you through that process to open up a claim. Again, it can all be done online, very, very easy. Within the holistic side, you pay for it, you get a receipt, you send it in, and you then get the reimbursement for whatever is above and beyond your cost. For example, like IV drip is you pay the first $25, and then Clearwater reimburses the next $100. So you can get IV drip once a month for $125 and get that difference reimbursed. For me, they typically say it takes 2 weeks. 2 to 3 weeks, I think. For me, I submitted on September 21st. I got the confirmation on either October 6th or 7th that the payment was going to be in my account on October 11th. So pretty fast. Again, a lot faster than insurance companies. If you've ever dealt with things from insurance companies, it takes months. I had issues with my billing and insurance after I had Grace, my daughter, who's 3.5, and it took over a year. I was sent to collections because my insurance couldn't figure out what was going on and like who was talking to who. And so like it affected my credit because they had sent it to a collection agency for, getting the money paid and that. So it's quite a racket. And then I actually just submitted on November 1st our holistic reimbursements for the month of November, and I got confirmation. I should have the reimbursement in our account. I think it was the end of next week that it would be there. So pretty good, pretty quick and fast for that. I also submitted my first reimbursement for doctor's visits for myself and Grace to be reimbursed, and that was, I think, on the 1st as well. So I'll be getting that later this month. Does anybody else have any other questions? It's just past 7:30, and so I want to open it up to questions and the opportunity to answer those or get you set up with next steps. We can always chat one-on-one for that. Awesome. Well, thank you for being here. Again, message me directly if you have any questions. I'll get you connected. I will check in with each of you and answer your questions. And I look forward to helping you to save some significant money. I see a question or something popped out. Awesome. Thank you, Regina. I'm so glad it was good information and worth your time. Thank you, Laura. I will get the link posted on YouTube so you can rewatch this and you can share it with anybody else that you may talk to that's complaining about insurance. So thank you again for being here. We'll talk soon. Bye, guys.